First Nation people continue to experience a burden of disease 2.3 times greater than non-Indigenous Australians. Chronic disease caused 64% of this burden. The budget includes funding for 17 critical First Nation health infrastructure projects across the country. Investing in primary care infrastructure will improve access to primary health care for people on country, closer to home, and avoid the need for this care to be provided in hospitals. Projects are spread across Australia, include the health facility in Palmerston in the Northern Territory for Danila Dilba Health Service, a new clinic in Ceduna for Yadu Health, and a new build in Bunbury for South West Aboriginal Medical Service. The government has committed $61.1 million for early intervention and preventative health actions, with a particular focus on chronic disease. The budget includes $45 million to address chronic kidney disease, the leading cause of hospitalisation for First Nation people, particularly in the Northern Territory, to deliver up to 30, and it was great to be with the Health Minister when we made this announcement, 34-chair renal dialysis unit and water projects. Site and timing will be worked out in partnership with key First Nation stakeholders. 1.1 for 2 dialysis treatment buses in far west New South Wales, $824,000 for the Tharawal Aboriginal Corporation Aboriginal Medical Service in New South Wales to expand needed and necessary renal and ECG facilities, and Redfern Aboriginal Medical Service to purchase machines for early detection of cardiovascular health conditions. $14.2 million to increase for, as the Minister said, rheumatic heart disease, screening, prevention and treatment services, which will be delivered in full partnership with the First Nation health sector. Improving health outcomes for First Nation mothers and babies is a priority to address the disproportionately adverse perinatal outcomes compared with non-Indigenous mothers and babies. We have committed $22.5 million to Wamaninda to establish a birthing on country centre of excellence, and I can say for the one in Alice Springs in the Northern Territory, the one in New South Wales South Coast will be just as good. The government is committing to building the Aboriginal community-controlled health sector and will provide $164.3 million for new and enhanced health facilities across Australia to provide increased and improved access for First Nation people to culturally safe care. Greater health benefits gains or benefits up to 50% can be achieved if services are delivered through an Aboriginal Community-Controlled Health Service or ACCHO. Aboriginal health in Aboriginal hands is the way in which we will make the difference. In 2016, it was estimated that the Aboriginal Community-Controlled Health Service served between a third to half of First Nation populations. The government has listened to the First Nation health experts. We will provide $54.3 million over 5 years to provide the important 500 traineeships for First Nation people in the Aboriginal community-controlled health sector. The remoteness of communities across the top end of the Northern Territory meant, Minister, for the member for Solomon, for myself and for Senator McCarthy, the access to aerial medical services is vital in critical emergency situations. The government providing funding of $10.1 million in 22-23 to CareFlight will improve greater access to rescue services and emergency aerial medical transport for injured and sick First Nation Territorians across the top end in the Northern Territory. So, I suppose, Minister, my question is, how is the Albanese government, if you could outline, continuing to work to ensure that the healthcare and infrastructure is delivered for Aboriginal and Torres Strait Islander people in a culturally safe and appropriate way?